Hey everyone, due to some recent health issues, I was unable to upload videos as planned. Really sorry for the delay and thank you so much for your patience and understanding. But I am back now and today we are starting an important topic that you can see here as menstrual disorder. We will be covering them one by one in an easy to understand way, just like we have done in previous session. So stay tuned and let's get started. So in previous sessions, we have discussed regarding detail about the menstrual cycle, their phases and all. So what we have studied this menstrual cycle, like it is a cyclical bleeding occurring in a reproductive female age between 15 to 49 years at a regular interval. That means every 28 days interval. And we said that it is a physiological process, like it doesn't have any pathological cause. Okay, so the menstrual cycle on an average duration is 28 days, and the menstrual cycle, the first phase is menstruation phase, that is the bleeding phase, and it stays for 2 to 8 days, on an average 4 to 6 days. Okay, and the bleeding blood loss during this menstrual phase, we said that 50 to 80 ml, on an average 35 ml. So we have discussed all the phases one by one in detail, and today we will be discussing regarding the menstrual disorders. Okay, so what is menstrual disorder? According to Williams Obstetrics and Gynecology, this menstrual disorder is anything abnormalities. Okay, abnormalities in frequency, abnormalities in frequency or duration, okay, or the amount of bleeding or regularity. Okay, it can be irregular in cycle, okay, of menstrual bleeding. Menstrual bleeding, what is the cause? Caused by any hormonal imbalance. Okay, or any structural pathology in female reproductive system, or any systemic illness. Okay, all can be the reason for causing this menstrual disorder. So what is the definitions of this menstrual disorder? Like any abnormalities in frequency, duration, amount or regularity of menstrual bleeding caused by this hormonal imbalance, structural pathology or systemic illness. ठीक है? So this menstrual cycle, what we said, on an average duration is 28 days. So if this menstrual cycle will be below 28 days or it comes more than 28 days interval, that can be classified under this menstrual disorder. So if this menstrual phase, that means the first phase of menstrual bleeding, that stays for 2 to 8 days, okay, on an average 4 to 6 days, okay, this bleeding phase. So if any bleeding phase, if any woman, this bleeding phase is stays for more than 8 days, or we can say less than 28 days, that also will be coming under this menstrual disorder. Okay, if any female, this average bleeding blood loss less than 5 ml or more than 80 ml, because average range of blood loss is between 5 to 80 ml. If it is less than 5 ml or more than 80 ml, that will be considered under this menstrual disorder. Understood? So anything frequency, duration or amount of blood loss, regularity of menstrual bleeding, anything, if any abnormalities are there in that ranges, amount, regularity, due to this hormonal imbalance or structural pathology or systemic illness, all will be coming under your menstrual disorder. So what is the classifications of this menstrual disorder? We will classify it one by one. Sorry, we will be classified them one by one. Okay, so classification of menstrual disorder. Okay, so the first classification of this menstrual disorder is amenorrhea. Okay, what is amenorrhea? Amenorrhea means absence of bleeding. Every reproductive female, this every 28 days interval, normal duration is 28 days if the female is getting this menstruation. But if any woman will be having any absence of menstruation, we will be consider it as amenorrhea. Okay, the second menstrual disorder is hypomenorrhea. Hypomenorrhea. What is this hypomenorrhea? Hypomenorrhea means, as you can see, hypo means scanty or less bleeding. Okay, scanty menstrual flow. Okay, so scanty menstrual flow will be considered as hypomenorrhea. Then the third menstrual disorder is your menorrhagia. Menorrhagia means, just remember, menorrhagia means excessive bleeding. Okay, excessive bleeding that can be more than 80 ml during your menstrual phases, means during the menstrual phase, menstruation phase or bleeding phase, or more than 8 days of this menstrual phase. Okay, normally it is stays for 2 to 8 days, right? 2 to 8 days, and normal menstrual blood loss is 5 to 80 ml, right? But here, when we will consider it as menorrhagia, if the woman will be having excessive bleeding more than 80 ml or the menstrual phase stays more than 8 days, we will be consider it as menorrhagia. Then the fourth menstrual disorder is metrorrhagia. Metrorrhagia means irregular bleeding. Here this amenorrhea means continue. Each month female will be having absence of menstruation. That means in a regular way the woman will be having absence of menstruation. Then hypomenorrhea means in every month the woman will be getting menstruation, but the bleeding will be in very less amount. Menorrhagia means excessive bleeding. That means in every month the woman will be having menstruation, but it will be in excessive amount. But all those cases are maintaining a regularity, although it is a problem, although it is considered as menstrual disorder, but still it is maintaining the regularity. But in case of metrorrhagia means it is irregular bleeding. Okay, irregular bleeding between periods, or we can say it is an intermenstrual bleeding. In normal cases, what happen if a woman, let's think, getting period on 5th Jan, then in next month again in 5th February she will be getting periods, menstruation. Okay, but in case of metrorrhagia, this 5th Jan, if a woman will be getting period, then not necessary that in 5th February she will be again getting this menstruation. She can get this menstruation on 20th January. Okay, that will be considered as metrorrhagia, means intermenstrual bleeding. Okay, now the fifth menstrual disorder is polymenorrhea. Polymenorrhea means, poly means multiple times. Okay, so polymenorrhea, another name is epimenorrhea. Just remember, epimenorrhea. What is this epimenorrhea or polymenorrhea? In this polymenorrhea means it is a short cycle. What is the meaning of this short cycle? Short cycle means every woman in normally they are getting period 28 days interval, right? But in case of this polymenorrhea, the woman will be getting period less than 28 days interval. Okay, so this is considered as polymenorrhea. Polymenorrhea means frequent cycle. Frequent cycle. Okay, then the sixth menstrual disorder is oligomenorrhea. Oligomenorrhea. As poly means multiple times, oligo means less. And this is infrequent cycle. Okay, means the frequency is infrequent cycle. The frequency is more than 35 days apart. Okay, we will say it as long cycle, just opposite to polymenorrhea. Okay, now then the seventh menstrual disorder, we will say at like dysmenorrhea. Dysmenorrhea means it is painful menstruation. Okay, this painful menstruation we will call it as dysmenorrhea. That also having classification, primary dysmenorrhea, secondary dysmenorrhea. We will come one by one. Then your premenstrual syndrome. PMS. Okay, what is this premenstrual syndrome? Premenstrual syndrome means this is a cyclical, physical or emotional symptoms before menstruation. So many female will be having this premenstrual syndrome, means before getting periods, 7-8 days before getting periods, female will be having backache, lower abdominal pain, headache, then breast tenderness, mood swings, all will be coming under this premenstrual syndrome and is considered as menstrual disorder. So what we have discussed so far, like various menstrual problem or disorder, like amenorrhea means absence of menstruation, hypomenorrhea means scanty menstrual flow, hypo means less. Okay, then menorrhagia. Menorrhagia means excessive bleeding. We will discuss in detail one by one, but just here we are giving a short intro about the various menstrual disorder. Then metrorrhagia. Metrorrhagia means irregular bleeding. Okay, irregular bleeding. Then your irregular bleeding or intermenstrual bleeding. Coming the next, that is your polymenorrhea. Polymenorrhea, another name is epimenorrhea. Polymenorrhea means short cycle. Means if a woman will be having polymenorrhea, then she will be getting menstruation less than 21 days interval. That means frequency of cycle is more. Okay, then coming to the oligomenorrhea. What is oligomenorrhea? Oligomenorrhea means infrequent cycle and long cycle. The woman will be getting period more than 35 days apart. Okay, each month. Then coming to the dysmenorrhea. What is dysmenorrhea? Dysmenorrhea means painful menstruation. Whenever woman will be having this menstrual phase, that is the bleeding phase, woman will be having pain. That is called dysmenorrhea. Then premenstrual syndrome. Premenstrual syndrome means cyclical, physical or emotional symptoms before menstruation. Mood swings, lower backache, lower abdominal pain, then headache, breast tenderness, all will be coming under your premenstrual syndrome. Now in today's topic of discussion will be amenorrhea. Okay, we will be discussing this amenorrhea in detail. So let's get started. Amenorrhea. Okay, so what is this amenorrhea means? Amenorrhea means absence of menstruations. Okay, absence of menstruation. So this absence of menstruations will be classified into two types. One is primary amenorrhea and another one is secondary amenorrhea. Now how will you differentiate what is primary amenorrhea and what is secondary amenorrhea? So primary amenorrhea means if I say failure of menstruation occur by, can be two types. Okay, age 15 years in girls with normal growth and secondary sexual characteristics. What is that meaning? The meaning is if a girl will be already 15 years old and having normal secondary sexual characteristics like already breast developed, then puberty, thelarchy, everything already attained, but still not getting this menarche means the menstruation, first menstruation, then we will be consider it as primary amenorrhea. Or else we can say if a girl will be 13 years age without this secondary sexual characteristics. Okay, so what is the definitions of this primary amenorrhea? Primary amenorrhea means simply we will say this the girl never attend or the woman never attend this menstruation, has not attended, menstruation has not attended before, has not attended yet. Okay, never gets her period. So what is the definition? If a girl having 15 years age with normal growth and secondary sexual characteristics, in presence of secondary sexual characteristics, 15 years girls still not getting her menstruation, or the 13 years girl without secondary sexual characteristics, we will be consider it as primary amenorrhea. Primary amenorrhea simply means no menses ever by expected age. Okay, then we will say it as primary amenorrhea. Now, what can be the cause of this primary amenorrhea? Causes. There are various causes due to which the woman is never getting her menstruation. So what are the causes? The causes are, can be hypothalamic pituitary disorders. Means this, in hypothalamus or in pituitary gland there will be something problem. What can be the problem? The problem can be Kallman syndrome. Now what is this Kallman syndrome? Kallman syndrome means it is a genetic disorder. What happened if a woman will be having this Kallman syndrome? Kallman syndrome means hypogonadotropic, hypogonadism. What is that meaning? Hypogonadotropic means gonadotropic hormone. What is this gonadotropic hormone? GnRH, gonadotropic releasing hormone. If any problem in hypothalamus, okay, hypothalamus release this gonadotropic hormone. If there is hypothalamus disorder will be there, then it will secrete less amount of gonadotropic releasing hormone. If the gonadotropic releasing hormone will be less, then pituitary will release less amount of FSH, less amount of LH. If this FSH and LH secretion is less, then ovary will release less amount of estrogen, less amount of progesterone. And these two hormones, as you know, is the main hormone of regulating this menstrual cycle. So if all will be in less amount, then there will be amenorrhea, means absence of menstruation. In which condition we seen this primary dysmenorrhea? In Kallman syndrome. If there is hypothalamic pituitary disorder will be there. Okay, now second causes we can say ovarian disorder. If the woman will be having any ovarian dysfunctions or ovarian disorder, we will be consider it as under primary dysmenorrhea, primary amenorrhea. What can be the cause? That can be gonadal agenesis or gonadal dysgenesis, like your Turner syndrome. Okay, Turner syndrome karyotype is 45XO. Now you see here only one X is present, another X is absent, right? So for female, we know for female the karyotype is 46XX. As because 2X present, that's why in case of normal female, ovary fully developed. Okay, now if a woman suffer with this Turner syndrome, because of this only one functional X chromosome is functional and another X is absent, absent. Because of this, ovary will not be properly developed. If ovary not properly developed, what will happen? There will be estrogen and progesterone secretion dysfunctions will be there. There will be follicular growth will be abnormal. Okay, so due to all this reason, there will be amenorrhea or menstrual disorder will be present. So this Turner syndrome also can be one of the reason of this primary amenorrhea. Okay, or we will say yes. Now third cause, what we will say, third cause is outflow tract obstructions. Outflow tract obstructions. What is that meaning? That means in each month, uterus superficial layer shedding off and the bleeding will occur. That blood will come through the vagina. Now, if there is any obstruction in the vagina, then there will be no menstruations. So, the example is like your imperforate hymen. Imperforate hymen means, we already discussed before, this imperforate hymens, also another name is cryptomenorrhea. What is that cryptomenorrhea means? In vagina there is one membrane, that is hymen. This hymen in normal female, partial hole will be there through which menstrual blood is coming. Now in case of imperforate hymen, there will be no partial hole. Okay, no partial hole, as a result no menstruation. If a woman will be coming with imperforate hymen, she will complain you like each month I will be suffer with this premenstrual syndrome, or that can be absent, but the main complaint she will be having, like I will be having cyclical pain in lower abdomen, but I am not getting any period. If you observe, there will be tensed or bluish bulging hymen, means already bleeding is there but no blood is coming. That will be coming under your cryptomenorrhea. What is the management? So what is the management of this cryptomenorrhea? You will give a cruciate means this kind of incision, cruciate incision, so that this menstrual blood will come out. Okay, menstrual blood flow occur. That is, imperforate hymen is one of the reason of this primary amenorrhea. Now another reason can be your transverse vaginal septum. Okay, so if any vagina will be having any transverse septum will be present, that can be also reason of primary amenorrhea, because no menstrual blood will be come out. And the another reason is Mullerian agenesis. Now what is this Mullerian agenesis? Okay, we will discuss in detail Mullerian agenesis. Now Mullerian agenesis means when in intrauterine life, the baby can be male or female, right? Male or female. If it is male, then it will be having Wolffian duct. If in intrauterine life the baby will be grow as female, then it will be having Mullerian duct. Okay, Mullerian duct. Now if a fetus, female fetus will be absent of Mullerian duct, that means Mullerian agenesis is there, then that will be the reason of this primary dysmenorrhea, Mullerian agenesis. Why I am saying due to Mullerian agenesis primary dysmenorrhea will be there? Because this Mullerian duct is responsible for growing the responsible for growing female reproductive organ like your fallopian tube, then your uterus, then your cervix, then upper part of vagina, upper 2/3 of vagina. Now imagine if a woman or girl will be having this Mullerian duct absent, then there will be no fallopian tube, there will be no uterus, there will be no cervix, there will be no upper 2/3 of vagina. Lower 1/3 of vagina will be present, as because that is not developed from Mullerian duct. But this upper 2/3 of vagina developed from Mullerian duct, cervix developed from Mullerian duct, uterus developed from Mullerian duct, fallopian tube developed from Mullerian duct. Now if this Mullerian duct is absent, then there will be no fallopian tube, no uterus, no cervix, no upper 2/3 of vagina. And because of that, if no uterus is present, then there will be no superficial layer shedding off. If there is no superficial layer shedding off, there will be no bleeding. If there will be no bleeding, means there will be no menstruation. If there is no menstruation, means that will be coming under your amenorrhea. So this Mullerian agenesis also one of the reason for causing this primary amenorrhea. So again we will discuss in detail about the primary amenorrhea's causes. So what are the causes? Hypothalamic pituitary disorder, that is your Kallman syndrome. Kallman syndrome is one kind of genetic disorder. What happen in this genetic disorder? There will be hypogonadotropic hypogonadism. Hypogonadotropic means gonadotropic releasing hormone will be in secret in less amount. Hypo means less, right? So if there is less amount of gonadotropic releasing hormone, then less amount of messages sent to the pituitary duct. As a result, pituitary duct will release or secrete less amount of FSH and LH. In response of less amount of FSH and LH, ovary will release less amount of estrogen and progesterone. Or as all these hormones secreting in less amount, there will be no menstruation, as all those hormones maintain or regulate the menstrual cycle. Okay. Now second cause will be ovarian disorder. Ovarian disorder like gonadal dysgenesis, like your Turner syndrome. Again, Turner syndrome karyotype is 45XO. Now remember, for growing this ovaries development, 2X chromosomes should be present in each cell. Now if, as because there is only one X and another X is absent, that's why ovary cannot fully develop or properly develop. If ovary cannot fully develop, we will call it as strict ovary. Okay, strict ovary. And this ovary cannot function properly. No estrogen progesterone will be released properly, no fallopian follicular growth will be there. As a result, amenorrhea will be there. Now the last cause, outflow tract obstruction. This is the vaginal tract. If there will be any obstruction, then it will cause amenorrhea. Then no bleeding, no blood will come through this vagina. As a result, it will causes amenorrhea. So what are the causes? Imperforate hymen, that is cryptomenorrhea. Okay. Then transverse vaginal septum. Again, if there is any septum present transversionally. Mullerian agenesis. What is Mullerian agenesis? During intrauterine life, male generate Wolffian duct, female body, female fetus, this Mullerian duct will develop. This Mullerian duct is responsible for growing this fallopian tube, uterus, cervix and upper 2/3 of vagina. If Mullerian agenesis is there, that means absence of Mullerian duct, then all those organs will be absent, will not present in female fetus. As a result, if no uterus is present, there will be no superficial layer shed off. If there is no shedding, there is no bleeding. If there is no bleeding, there is no menstruation. As a result, amenorrhea will be there. Okay, so these all are the causes of your primary amenorrhea. Now, what is the, how will you identify this is primary amenorrhea, not secondary amenorrhea? See, you can see here this Mullerian duct, this Turner syndrome, okay, 45XO, this hypogonadism. This is also a genetic disorder. So maximum genetic disorder are the causes for this primary amenorrhea. So what is the diagnosis method? You will do karyotyping. Okay, karyotyping. Then you will identify whether it is a case of primary amenorrhea or secondary amenorrhea. Okay, now these all are the reason. Now coming to your secondary amenorrhea. This is the secondary amenorrhea. So what is the definitions of this secondary amenorrhea? The definition according to Williams Obstetrics Gynecology: absence of menses. Okay, absence of menses for more than equal 3 consecutive cycle in women with previous regular period. So if a woman who will be having regular periods every month, she used to get period at the same time, now last 3 consecutive cycle she is not getting her periods, we will consider it as secondary amenorrhea. Or else we can say more than equal 6 months in a woman with previous irregular cycle. Now if a woman will be having irregular cycle, we will check if last 6 months she didn't get any menstruation, we will consider it as secondary amenorrhea. Or in case of woman will be having regular periods and 3 consecutive cycles she didn't get her periods, then also we will consider it as secondary amenorrhea. So what you understand, that secondary amenorrhea means previously in earlier female was menstruating, okay, menstruating normally, but now she doesn't have menstruation. This is considered it as secondary amenorrhea. Now what can be the causes? Causes of this secondary dysmenorrhea, secondary amenorrhea. Causes, okay. Causes of this secondary amenorrhea. First, we will rule out whether the woman is pregnant or not, because during pregnancy there is no menstruation. So always the first possibility to rule out the secondary amenorrhea is the pregnancy. Okay, so if a woman is pregnant, then she won't be having this menstruation and will be considered it as secondary amenorrhea. Then any hypothalamic causes, okay, hypothalamic causes. What are the causes? Causes like excessive stress, okay, rapid weight loss, any kind of eating disorder, excessive eating or severe diet control, okay, or excessive exercise, all will be causing this absence of menstruation, will be coming under your secondary dysmenorrhea. Okay, then third cause we can say as pituitary causes. Pituitary causes means Sheehan syndrome. Sheehan's syndrome. We will discuss it in detail in gynecology portion. Like what is Sheehan syndrome? Sheehan syndrome is postpartum pituitary necrosis. If there is pituitary necrosis, there will be no menstruation. That will lead to secondary amenorrhea. Okay. Now, what other causes can be there? Causes like ovarian causes. Ovarian causes like you can say PCOS. What is PCOS? Polycystic ovarian syndrome. If there is any cyst present in ovary, that will also lead to irregular menstruation, okay, or absence of menstruation, lead to secondary amenorrhea. Okay, now there will be another causes like uterine cause. What are the uterine causes? Like your Asherman syndrome. Asherman's syndrome. What is this Asherman syndrome? Asherman syndrome means if it is uterus, right? If there is adhesion present. Why this adhesion will be present in uterus? Intrauterine adhesion intrauterine adhesions after curettage or due to any infections will lead to adhesions, and that will lead to Asherman syndrome, which causes your no menstruation. Well, okay, this Asherman syndrome, or if there is any endometrial scarring from TB, okay, that also lead to this scarring of this endometrial tissue leads to no menstruation and will be considered it as secondary dysmenorrhea. Okay, after causing this infection, the woman will be having no menstruation. Before that, the woman will be having regular period. So that's why it is considered it as secondary amenorrhea. Okay, so what are the causes of this secondary amenorrhea? Like pregnancy. First cause you have to rule out. Second is hypothalamic causes like excessive stress, rapid weight loss, any kind of eating disorder, excessive exercise, all will lead to absence of menstruation or secondary amenorrhea. Then pituitary causes like your Sheehan syndrome. Sheehan syndrome means after postpartum period. After delivery, that means during postpartum period, there will be pituitary necrosis. That leads to your secondary amenorrhea. Ovarian causes like any kind of cyst, polycystic ovarian disease, PCOD, PCOS, all will lead to your secondary amenorrhea. Uterine causes like if there is adhesion or scarring present due to any curettage, infection or TB, okay, that will lead to your no menstruation and will be causing secondary amenorrhea. Okay, so you have to find out whether there is any pregnancy, whether any hormonal problem is there or not, if the woman is suffering with stress, excessive dieting or overeating. So you have to do all those history and physical examination to rule out the secondary amenorrhea. So that's all about today's class. What we have discussed in today's sessions, like menstrual disorder, the definitions of menstrual disorder, and the classifications like amenorrhea, hypomenorrhea, menorrhagia, metrorrhagia, polymenorrhea, oligomenorrhea, dysmenorrhea, premenstrual syndrome. Okay, and in detail we have discussed about this amenorrhea, their classifications like primary amenorrhea, secondary amenorrhea, what is the definitions of primary amenorrhea, what is the definitions of secondary amenorrhea, what are the causes of primary amenorrhea, what are the causes of secondary amenorrhea, all we have discussed in detail in today's session. Okay, in next part we will be discussing the remaining menstrual disorder like your dysmenorrhea, their classification, oligomenorrhea, premenstrual syndrome, polymenorrhea. Those are the small topic we will cover in next part. Okay, so thank you so much students. Keep your preparations in track. Thank you so much.